Dr. Janine here. Today we are doing Vasisthasana, or the side plank. This is an awesome exercise for any woman looking to rebuild or re-strengthen or get to know her core, but it's especially wonderful postpartum once you're several weeks, months out, of course, and you've talked with your physical therapist and or your birth provider. Because the muscles that are engaged in the side plank are primarily the transverse abdominis, the internal oblique, the external oblique, as well as all the muscles on the outside of the bottom hip and the muscles that surround that bottom shoulder. So it's really great for building stability through the joints, through the muscles in the shoulder joint and the hip joint, and it also will start to work those muscles that are going to help rebuild that core and bring your linea alba back to the right sort of length that is going to help, or width rather, that is going to help you with managing intra-abdominal pressure really well after you become a mom. Okay, so let's get started. We'll start with a basic version of Vasisthasana, side plank. So that's going to have you down on your elbow and down on your thighs, okay? So right here, what I want to do, I want to try to bring my head in line with my spine. I don't want it to come forward like a chicken. I'm going to scooch my knees back a little bit as well, so that it seems like they're almost in line with my trunk. It can feel a little bit tight, especially like if you're a new mom, because we have a lot of tightness in the hips, in the front, and in the thighs. So it can feel like it's difficult to get those legs in line with your trunk. So do what feels right for you. And what I want you ladies to do is just take a deep breath in. And then with your exhale, I want you to engage that pelvic floor a bit, like you're holding in gas and holding in urine at the same time. You'll feel that deep lower fibers of the transverse abdominis turn on at the low belly, like right in front of your bladder or around your cesarean scar if you had a cesarean. And from there, you're going to start to feel a little firing up on the side wall of your trunk. That's your obliques. And then I want you to press down into your arm, because we don't want to slump into that shoulder, because that'll put unnecessary stress on those ligaments. If this is your limit here, take a rest. And if you feel like you could do a little bit more, our next step, what I want you to do is engage a little more firmly up through that core, zip those thighs together, and with an exhale, you're going to push into those knees so you can lift your trunk up a little bit. So I'm trying to form a straight line from knee to shoulder to the crown of head. I'm pushing down into my arm. It's a little bit harder than you think, especially if you're down on a yoga mat, something that has a little compliance to it. And once you raise those hips up, I bet you felt an extra need to engage through that deep core. So the pelvic floor, transverse abdominis, and then what follows suit are the obliques. So I know you're doing great. So let's come on down. You can choose to do whichever of those two levels felt right for you, or you can turn and we're going to do the next level up, okay? You're going to do 3 sets of whichever felt right for you. All right, so now we're going to come up to the palm, and we're going to stagger the feet with the top leg in front, okay? On an exhale, I'm going to engage up through that pelvic floor, holding in the gas, holding in the urine. I felt my low belly tighten. Take another breath, holding that contraction. And then with that next exhale, I'm coming up to my hand. So I'm trying to bring my shoulders so that they're stacked. I'm lightly squeezing my inner thighs together. Just brought my head in line with my shoulders. And I'm continuing to engage that deep core. I'm trying to pull my side up to the sky a little bit. And are you still pushing into that palm? We're going to hold for 2 more breaths. You guys are doing fantastic. So you can see that every version of this kind of incorporates the same muscles. It's just to a different degree on what feels right for your body. So, come on down, mamas. We're going to go to the other side, okay? So we're going to start exactly the same way. Start down on the forearm, down on the elbow. Knees are just barely in front of your trunk, right? Because it's hard to get them fully in line when you're down this low. And with an exhale, you're going to engage pelvic floor, holding in P, holding in gas. That low belly transverse turns on. Then you start to push into your elbow, push lightly into your legs, and you're going to try to lift up through your side. Bring that head in line with the rest of your body. Think about keeping your shoulders in the same plane. And I have a feeling you're looking fantastic, and I'm so glad you're honoring your body. And we're going to lower down in 5, 4, 3, 2, lower it down. Okay, so next one, we're going to have our weight going through that same elbow and more so through the knees, the end of the thighs, okay? So take a deep breath in. With your exhale, engage that pelvic floor, that deep transverse abdominis, down low over the bladder. And then breathe in again, keeping that engagement. Exhale, rise up a little bit. Yeah, so now we've lifted those hips, and that kind of magically puts you in a straight line once you lift those hips from knees up to shoulders. And I'm trying to push down into my elbow, trying to keep my neck and my head in line with my spine, and really keep that engagement through that deep core. It can feel tough. I feel like my elbow's a little far out to the side, so I'm going to scoot mine in. So if you felt like that, scoot it in a little bit. And we're going to hold for 5, 4, 3, 2. Great job, mamas. Okay, so for the third one, stay with either of those 2 variations for you, or you're welcome to come up to the third one, okay? The hardest level. So your feet, you have the top leg in front to help in case you lose your balance a little bit. We're going to come up to the hand, and we're going to use that same tactic of engaging with the exhale, holding that engagement, and then using your next exhale to come up to the highest position, okay? Because we want to exhale during those difficult transitions to provide more stability and more pressure management. Okay, so inhale. Exhale, I'm engaging my pelvic floor, holding in gas, holding in urine. I can feel my low belly tightening. I'm starting to push into my palm as preparation, and I'm going to inhale again. And exhale, I'm going to actually move, lifting myself up. Beautiful job. Now, ask yourself, what can you put in line? Can you get your head in line with your shoulders? Can you make sure that top shoulder is stacked over the bottom? Can you try to keep your hips stacked even though your feet are staggered? And remember, you're still lifting up through that pelvic floor. You're nice and firm across that low, low belly. Your sides pulling up to the sky while your hand is pushing down. And even let's push down a little bit into those legs, almost like they're scissoring a little bit. We got 2 more long breaths. You are doing so good. Whichever level you are at, I am really proud of you. I just want you to know. 1 more breath. Ooh, exhale on that effort as we come down. Great job. Start incorporating that into your core routine several times a week. And I'm really confident that if you listen to your body and are consistent, you're going to notice a difference. Thanks for watching.